All right. Hello, everybody. Thank you for joining us for our last session in the Telehealth Summit webinar series. I can talk. Bedside to Webside, Optimizing the Telehealth Experience. Today, we have Lara Goorland and Brittany Colonna with PWNHealth. And if you'll advance the slides for me real quick. All right, just a couple logistics before we get started. So all attendees are in listen-only mode. You will not be able to unmute yourselves. If you have a question, please use the Q&A function on Zoom for questions or comments to the speakers. If you're having any technical or logistical issues, you can't hear, audio's gone bad, something is going on, please use the chat function on Zoom. And as always, of course, the recording and the presentation slides from the session will be made available on our website. It will be up later on today. Next slide, please. And with that, I'm going to turn it over to Brittany and Lara.
Thank you so much. Hi, everybody. We are so excited to be here with all of you today and really are so thankful for the opportunity to share some of the really exciting work that we have been doing with you. We were looking forward to going to the Telehealth Summit and meeting some of you in person in Lake Tahoe, but given the circumstances of the pandemic, we really are so happy to still have the opportunity to share. So today, we are going to talk a little bit more about optimizing the telehealth experience in this session titled Bedside to Webside. And for starters, we just want to share a little bit more about ourselves. I am Lara Goorland. I'm the Senior Director of Clinical Operations here at PWNHealth. I joined in 2017, and I oversee our network management team, and I work directly with our physician network, as well as oversee all of our telehealth programs. I'm involved in the development and implementation of new programs, in addition to the maintenance of our network and our current programs. I have a passion for improving access to care and enhancing the patient and physician experience. And I'll turn it over to Brittany.
Hi everyone, I'm Brittany Colonna. I've been at PWN for just over 2 years now, and my main role is to ensure the delivery of a quality telehealth experience to both our patients and providers. And part of that includes developing physician trainings with our clinical team that are effective in providing our doctors with the resources and tools that they need to then create a good experience for our patients. And one of these trainings is focusing on website manner, which we're going to be talking about today. And we hope that you'll be able to take some of what we learned and implement it in your own practice. So just to give you an overview on what we'll be discussing today, we'll start by giving you some background on our company and what we do, what our culture is like, and then we'll talk about the steps that we took to identify a need for our website manner training. How we established a baseline of our physician knowledge and experience to help us develop the training, and finally, how we were able to measure the success of this training and adapt it to other areas of our company. And while this training was developed and implemented prior to COVID-19, we're also going to speak on how this initiative has helped us to continue to deliver a quality experience to so many patients at a time where telehealth has really become prevalent today during the pandemic.
So for starters, we would like to just start and tell you a little bit more about PWNHealth and what our company does, and then we'll talk a little bit more about the culture here. So PWNHealth is a national clinician network serving all 50 states as well as Puerto Rico and the Virgin Islands, and we are equipped with telehealth and telegenetic services. Our model enables access to safe and easy diagnostic testing, ensuring clinical validity, utility, and quality consumer education, access to clinicians, and the ability to implement national programs seamlessly. Our solutions provide the clinical, legal, and technological framework to facilitate large-scale consumer testing across key healthcare markets. We are shaping a new paradigm in healthcare, built around disease detection and prevention. And we really genuinely believe that empowering people with convenient access to clinically actionable testing has the power to change lives, improve outcomes, and create a healthier world. Additionally, since the pandemic began earlier this year, we've been able to play an instrumental role in helping our country in getting people tested. Currently, we have provided almost 3 million COVID test results to patients nationwide, accounting for about 5% of the nationwide testing efforts and almost 7% in California specifically. At PWN, we are extremely lucky to work for a company that really does have such a powerful culture. This culture has been shaped by our company's vision to change healthcare by providing individuals with access to take control of their own health. Employees are taught the core value to always make choices based on what's in the patient's best interest. And to do that in the virtual care space is unique and really requires the bridging of various parties, fields, and goals, all of which present us with new challenges each and every day that we're always ready for. The first challenge is to align both our technology as well as our clinicians to develop an offering that is satisfactory to patients, regulators, and executives. Compounding this challenge is the ever-changing telehealth landscape with the proliferation of usages as well as patient expectations. COVID brought on additional layers of complexity with this, as COVID changed several state regulations, including waivers and temporary licensure. Within this dynamic environment, it can be all too easy to lose sight of the number one goal any telemedicine program should have, putting the patient first. So how do we do that? To ensure that we're always working with this mission in mind, we have implemented a number of effective best practices to elevate the quality, standards, and experience of the telehealth field for patients and practitioners within it. The first being patient feedback. We have implemented surveys as a way to collect data to drive experience improvements, provide physician feedback, and to receive confirmation from patients that their needs have been successfully met. We're constantly monitoring these survey responses and following up with patients on an individual basis. We realize that one size fits all does not work, and we try our best to personalize our interactions when following up with patients. Our second practice is to provide our physicians with trainings that will help set them up for success. These trainings cover telehealth best practices, treatment protocols, and regulation updates. The more we can help our doctors by providing these trainings, the better we can ensure our patients are provided with a high quality experience. Last, we also provide trainings for our non-clinical support staff. These are people who monitor our customer service line and call patients with their lab results. These representatives need to be trained on customer services best practices, as well as have extensive training on how to speak with patients about sensitive health information. Imagine being told that you have some concerning health information. We try to do everything we can to deliver the message in a way that the patients feel as supported as possible. Today, we will demonstrate how these practices led us to develop a physician training focused on webside manner. We will discuss the process and results of this training, including the positive impact that has been reported via our patient satisfaction scores. So you may be asking yourself up to this point, what is webside manner? Webside manner is essentially the virtual equivalent of bedside manner, or the collection of behaviors that affect how a healthcare professional presents to and interacts with his or her patient in a virtual environment. With good webside manner, you can establish an immediate, intimate connection with the patient and allow them to feel more comfortable sharing vital health information, which is especially important for sensitive health issues like STDs. A doctor's words can also have a real effect on patient health outcomes. Studies have shown that good website manner can actually increase the efficacy of treatment if the patient believes the physician is confident, supportive, and ultimately making the decisions that are in the patient's best interest. I don't know about any of you, but during the pandemic, I used telehealth both for myself as well as my son. I'm sure that I pay attention to all of the details and all of the specifics because this is what I do all day, but I can say that the interaction, whether it's a phone or a video encounter, really is so important. I can immediately feel if there's a connection between me and the provider, whether it be my primary care physician or somebody I'm using through a telehealth service for a visit. Making the patient feel like they're valued, being listened to, and not rushed off the phone is so important. So before we get into the training itself, we'd like to share a bit of background on how we identified this need and hopefully give some insight on how you may identify a similar need within your own organization. So after we initially launched our telehealth programs just about 4 years ago in the end of 2016, we realized that we needed to hear from patients on how we were doing and what areas we could improve. We launched our patient surveys soon after and were able to turn feedback into actionable changes within our growing programs. For example, we got feedback from patients that they wanted the call from the physician to be sooner. So what did we do? We improved our turnaround time in addition to enhancing the patient-facing information to be more clear on hours of operation and setting expectations of when they would receive that call. We always like to exceed the patient's expectations and now often call much quicker than within the required turnaround time. Over time, we've enhanced these surveys to gather more information on how we can improve our communication, our physician interactions, and our follow-up. Lastly, we realized in addition to the patients, it was just as essential for us to understand our physician network and have a better understanding of what type of both formal and informal training they had in virtual care throughout their medical careers. And we'll share more with you on that in just a few minutes. Our feedback surveys are sent to patients after their telehealth session to provide a way for patients to inform us of their experience. It also gives them the opportunity to report any additional clinical information, such as unresolved symptoms, side effects to medications, and ask any follow-up questions that they may have. The information provided via these asynchronous channels allows us to triage follow-up outreach appropriately with either having a care coordinator or a physician contacting the patient for follow-up on a case-by-case basis. If you take a look at some of our survey questions here, you can see that they're designed to capture data on customer loyalty using our NPS survey, in addition to receiving feedback on the physician in areas such as knowledge, courtesy, and privacy. Over time, we've continued to monitor feedback on our physicians, mostly good, but at times reporting that the conversation maybe did not meet that patient's expectations. We follow up on 100% of patients that report negative feedback, and we notice that there are some things that we could try to change. For example, a patient reported that the doctor seemed a bit short. Another patient reported it sounded like the doctor had some background noises like they were in a car. This led us to ask the question, have our doctors received adequate training on virtual care best practices? And we knew that we first needed to answer this question before we could take the next step.
So as the first step in developing our training, we decided we needed to determine what kind of telehealth education our physicians already received, whether it was in medical school or throughout their medical career. And at the time, we did some research and found that actually only 58% of medical schools provided training focused on telehealth specifically back in 2017. And that education varied anywhere from just a few hours to a full course on the subject. So with that in mind, as well as the fact that many of our physicians graduated med school before 2017, we anticipated that there was going to be some variation in our physician network's reported education. So to get a better picture of this educational baseline, we surveyed our physician network, asking questions like, how well did your medical training prepare you for providing services in the virtual care setting specifically? And have you been trained on the policies and regulations of virtual care? And these types of questions were asked as part of a pre-assessment tool that we would then compare later on after our training to responses to a post-assessment tool. We then analyzed the responses to this survey to determine our network skill set. And we found that while some physicians reported having adequate telehealth training, over 60% of the respondents had only some or no training at all on the subject. And we also found that 19% of respondents reported not being adequately trained on telehealth policies and regulations, which could definitely put us at risk from a legal and regulatory standpoint. So with both of these findings, we were able to highlight the need for a more comprehensive training that could supplement any prior education or experience these physicians might have had. And with control over the material, we could then make sure that our physicians were trained on the right topics that we knew were essential to providing a good patient experience, and establish a new educational baseline for our network. So to develop this training, we compiled information on website manner and telehealth best practices from a variety of sources. We did extensive research and we referenced scholarly journals. We also coordinated with our clinical team and our chief medical officer, as well as our clinical advisors who are experts in a variety of different fields to ensure that our education was clinically sound before sending it out to the network. So how are we training? The training that we developed included tips and information on how to establish relationships and communicate effectively with patients through virtual means, as well as a refresher on telehealth best practices. And we'll cover some of the tips we presented in this training on each of these topics for anyone who's looking to use the information in your own practice. So often with telehealth visits, we can lose sight of the importance of establishing relationships with the patient because it's challenging, you know, when you can't see the patient or when the conversation is only lasting a few minutes, and when there's a good chance you may not see this patient again in the future. But studies actually show, as Lara had mentioned, that building a relationship can actually increase the efficacy of treatment. So to help our physicians, we provided techniques on how to build trust with patients so that they can feel comfortable sharing vital personal information. And when a patient receives a call from a telehealth provider, they might be in the middle of something, you know, you're in the context of your daily life. So we educated our network to, as soon as the patient gets on the phone, to identify themselves as PWN physicians at the very start of the call to bring patients into the context of the session. And once on the phone, we advise our physicians to confirm the identity of the patient through name and date of birth validation so that, one, we can assure that the health information being shared is being discussed with the correct individual, and make sure that we're keeping in line with HIPAA regulations, but also too, so that patients can feel secure knowing that we are taking measures to protect their privacy. We also have physicians confirm the current location of the patient as soon as they get on the phone, because telehealth policies and regulations require that patients speak with a provider who is licensed in the state that the patient is currently in during the time of the consult, regardless of where the patient lives. So this has actually been a big one for our company. We see many of our patients are actually using our services while they're on vacation for urgent health concerns like UTIs, since they can't see their PCP while they're out of town. And while these patients are typically looking for a quick and convenient one-time deal of a service, we also want to make sure that we're still establishing that relationship, even if it's just for 5 minutes, so that each patient is really given a quality experience where they feel comfortable enough to speak openly and honestly about any health concerns, and hopefully will use our services again for a future need if that happens. So to demonstrate these practices, we also included an audio recording of a telehealth mock session, just to give physicians an idea of how they can guide conversations during a typical encounter, and kind of provide an extra resource for them to use. The next topic we covered was how to communicate effectively in the virtual setting. Our first tip for providers is to review the patient information in advance so that once they are on the call with the patient, they kind of already know what questions they're going to want to ask based on the patient's reported medical history and all the information that they had at their disposal. We also know that many telehealth providers are in it for the flexibility that it provides. So with that flexibility also comes responsibility though, because these physicians may not be in a clinic all the time. But something as little as background noise while you're on a call with a doctor can actually, distract the patient or decrease the provider's credibility in the eyes of the patient. So we ask, even if they're not in the clinic, we encourage our providers to conduct consults in a private and quiet setting to make patients feel that they have the full attention of the provider and really are being put first in this context. During the virtual encounter, it can also be harder for patients to express their concerns and easier for them to feel detached from a clinical experience where the doctor can't really see them or can't touch them or feel them. So we included some tips on how to get patients to play an active role in the experience through shared decision-making between the physician and the patient, encouraging our providers to let the patients express any and all concerns and really listen to those concerns and engage in the discussion with the patient. This practice and these tips really came into play when we started providing COVID-19 sessions, because as you all know, there were and still are a lot of questions regarding treatment, risk, quarantine and return to work guidelines. And in many cases, our doctors couldn't answer all of the patient's questions. But when our physicians were able to express empathy and understanding to these patients, even if they couldn't answer all of their questions, as long as they expressed that through the phone, we were still receiving positive feedback that patients were just happy a physician took the time to listen to them and understand, what they're going through, and also just help the patient understand everything going on during this pandemic. But this form of emotional communication can and should be applied to any type of virtual encounter, not just limited to COVID-19. Because people can always hear and appreciate empathy over the phone. They can also hear distractions and notice when they're being rushed off the phone. So that's something we always want to keep in mind when we talk about communication. And as we saw in the pre-assessment survey responses, some physicians were not so familiar with telehealth policies and regulations. So we included a refresher on clinical best practices for them. This included reminders to make sure that they're documenting all relevant information. So if a patient ever calls back with a question, we can easily access their information. And it also includes noting the dosage and frequency of medication when a prescription is involved, so that if a pharmacy ever calls with a question regarding a medication, we'll have that information at our disposal as well. Lastly, with clinical best practices, we always encourage our providers that if something ever seems, more complex with the patient, there's never an obligation to treat via telehealth. And we should always act in the patient's best interest and feel comfortable telling them to seek in-person care when necessary. And this also applies to non-treatment sessions as well, like COVID-19, where any patient experiencing severe symptoms like extreme difficulty breathing, as we see with COVID, is advised to go to the ER for immediate care. There's no obligation to keep the patient on the phone and guide them through. We want them to get the care that they need when they need it.
So after we sent this training to our physicians, we determined 2 ways to measure the success of this training program. First was a post-assessment survey that was sent to our physicians, and second was that we analyzed our post-training patient feedback scores. We sent our post-assessment physician survey 2 weeks after they completed the training, and responses showed that the training was very well received. 96% of respondents replied that the training helped them establish relationships with patients, and 100% said that it helped them communicate effectively and served as a resource for information on the policies and regulations in a virtual care environment. We also received feedback that they enjoyed the mock session that Brittany mentioned earlier and thought that the training would be helpful for new doctors in telemedicine. So now that is something we're going to start to have available as part of our training process. Many of our new providers that we have brought on since the pandemic, as we've been growing, have experience in providing telehealth services and/or have been trained throughout their medical career on policies and regulations. However, we do, as part of the onboarding process, we do have this standard training as to what we expect with all of our physicians within our network. We also sent another survey to our physicians back in May to get a better understanding of their experience as a physician during COVID-19. And what we actually found is that with the pandemic, Many of our providers were starting to dedicate more time providing telehealth services, which makes Webside Manor even more important. As another measure of success, we compared patient survey responses from before and after the training was completed. We looked at specific survey questions that asked patients how they would rate the physician's knowledge, courtesy, and privacy, and saw improvements across the board. One thing we also got a lot of good feedback on is that our physicians do a great job at empathizing with patients. Just to share one quote from a COVID patient, "The doctor was so nice and comforting for someone like me who stays anxious and reassured that I was healthy and I'd be fine. This is a time where people are scared. What we hear in the news every day, and having a medical professional really make you feel like you're going to be okay and answer any questions and put you at ease really is so important." During COVID specifically, we have continued to receive some really amazing feedback. We've delivered almost 3 million results nationwide, almost 700,000 of those in California alone. We worked with different populations, such as retail pharmacies like Walgreens and Rite Aid for drive-through testing, in addition to working with one of our partners who even helped stand up testing for homeless individuals in California. For 77% of our COVID patients that had a telehealth session after getting their results, this was their first time using any type of telehealth-based service. And 94% of those individuals said that they would use a similar service for a similar need in the future. 68% of those patients also said that they feel that the information they received was better than they think they would receive in an in-person session. Through these measures, we were able to conclude that our Webside Manor training had truly enhanced our patient experience. Another thing that we've implemented at our organization, which can be a great addition to yours, is sharing quotes internally with our team from patients and clients about the impact we're making. Here at PWNHealth, we use Slack, and what we try to do is anytime we get a really special quote from one of our patients, we share it with the team to let everybody know that even people behind the scenes are really helping make an impact in these patients' lives. When COVID began, our patients were extremely grateful to have the opportunity to have the telehealth session in the comfort of their own home, sitting on their couch, not having to go to an urgent care or a doctor's office, where they would be putting both themselves as well as healthcare professionals at risk. We then realized, as we started receiving feedback from patients about their COVID testing experience, that we were getting tremendous feedback on the impact it was having in the lives of both the individual as well as their families. We felt that this was an optimal opportunity to better learn and understand our patients and their own unique journey at one of the scariest times our country has ever faced. We launched our patient testimonial project, where we offered patients the opportunity to share their story with us, so we can, one, learn more about the patient journey, and two, be able to share with the rest of the team the impact that each and every employee has had, with the end goal of putting the patient first. We're currently in the process of having a page on our company website that shares some of this great feedback, and I'd like to just share one brief story with you today. Carol and her husband spend their summers on an island in Maine. While she only got a COVID-19 test as a requirement for travel to the state, she was completely shocked to receive a positive result. She knew that she needed to speak to a physician to understand how this could be. She loved the experience with Dr. Lee and appreciated that they had the state of Maine in common to talk about, a conversation piece which helped put her at ease during this time. Carol may be almost 70 years old, but she's fortunate enough to still have her mother with her. And the hardest part for her had been going months without seeing her and not knowing when it would be safe to do so again. And I think just everybody listening to this right now can relate to this feeling, worrying about relatives being exposed and not being able to see loved ones for several months. Really, really unique time, but we're happy to at least make that experience the best that it can be.
So after launching our Webside Manor training program, we started to think about the potential for broader applications and adaptations within our company. So We started by adding the training to our onboarding process so that all new physicians are given the resources necessary to be successful in this role from the very start. But after doing so, we then realized that the material covered in our training could also benefit our network of genetic counselors who conduct consults as well in the virtual environment. So what we did was we took all that information and we adapted it to fit the needs of our genetic counselors and added it to their onboarding process as well. So now we have a full clinician network that has a qualified background, educational background in telehealth and website manner. Finally, we continue to monitor our patient feedback and we follow up with patients on an individual basis to identify any additional areas that we see that there could be improvements where we can build out our trainings and resources. So looking forward, we plan on expanding this training even further. Some of our doctors said that the audio recording of the mock session was so helpful that they'd like to hear additional recordings of different types of consults. And while we talk about trainings, it's also important to keep in mind that people have different learning styles. So we made it a goal of ours moving forward to incorporate aspects into our trainings that are beneficial to different learning styles, whether it be visual, auditory, or other, just so we're hitting all those categories and really providing the best training we can to a broad audience of learners. When it comes to telehealth updates, there's been no shortage of updates during COVID-19, anywhere from temporary licensure to video regulations. So we continue to send updates to our network in real time as the landscape continues to evolve. And finally, we are incorporating our website manner training into our annual trainings to serve as a refresher to our providers with the idea that, the more times we can reinforce this information, the better outcomes we'll see over time. So for us, when the pandemic hit and we were experiencing exponential growth in patient volume, we had to develop a scalable training process to support the growth of our network in just a few months. The result was this standardized and virtualized training experience where physicians reviewed training decks, and this included our website manner training. So after reviewing the decks, we also asked them to complete feedback surveys where they could rate the training and provide feedback on anything that they wish was included. And as we've continued to grow, we're now looking at new ways to make our trainings more interactive. For example, we're trying to use knowledge checks now, which are just questions throughout the training to keep the learner engaged. And we're doing that through some online training solutions like Lessonly. And the practices that we've discussed today can be generalized wherever an organization is on their telehealth journey. So organizations that are new to the field can use this approach to ensure that they're ready to take the plunge, while those already in operation can use the practices that we discussed today as part of a continuous improvement for both provider education and patient experience. And now during COVID-19, that telehealth has really expanded during this whole pandemic, it's going to be even more important for those of us involved in telehealth to provide a quality experience that's built on good website manner so that we can retain the patient volume that we're currently seeing and keep these patients coming back for more and continue to help grow the industry as we move forward.
So again, really would like to thank you to everybody watching for taking the time to join this webinar. Please feel free to reach out if you have any questions. If you're starting up a telehealth program or are looking for ways to embed this into a current program, we're always happy to answer any questions and help in any way. So maybe for now, if anybody has any questions, happy to answer. Otherwise, you can feel free to reach out to either Brittany or myself after, and we're happy to discuss further with you. Thanks for having us.
Yeah, thank you.
Absolutely. Thank you guys for your presentation. That was amazing. I have some questions, but if anybody that is participating in the webinar has questions, please feel free to type them into the Q&A box while I am reading our last slide here. So again, thank you so much for joining us, everybody. We really appreciate your participation, and we hope you've enjoyed the series. All of the recordings for the previous events are up on our website, and you are free to view them. I can talk, man. You are free to view them at any point. And again, as a reminder, this session will be up by the end of the day today. All right, so my question, and I'm going to put you all on the spot, and you may not have an answer, and that's okay. I was curious if you guys have any tips or a best practice for providers that are maybe uncomfortable being on video. You know, sometimes people get on video and they freeze. It's almost like they're on TV.
Sure. I'm happy to take that one. And I think that my answer to that would be is that it's uncomfortable sometimes, especially when you see yourself also on the video. So what I would suggest would be actually practicing in a mirror and getting comfortable. I think sometimes it's a little bit awkward, you know, having facial expressions and body movement when there's not somebody actually in front of you, and it can get a little bit awkward. So I would say my advice would be to practice at home with your spouse or one of your kids. Do it in front of the mirror. I think it's the kind of thing that you're not just good at it or bad at it, you get better. And I think that practice, especially in being uncomfortable in a video session, definitely can help make the provider feel more confident and at ease when having that interaction with a patient.
Yeah, and this is just so important right now. You know, during the pandemic, everything's being virtualized. So like this even extends to people who are going on virtual interviews. Like not everybody is comfortable being on camera. And I think this pandemic has really made it more necessary for people to get in that practice. But I completely agree, Lara, with what you said. You know, just practicing, even if it's just you looking in the mirror, or if you want to call up a friend or a family member and get them on FaceTime and, you know, be able to practice that way. So it's a little bit more legitimate with the camera on you. I think that's the best way to really get more comfortable in that setting.
All right, and I have another question. Did PWNHealth or your providers deal with any patients that were maybe uncomfortable themselves using telehealth, and how were they advised to kind of help a patient become more comfortable with that?
Sure, that's also a great question. So first and foremost, in addition to having our physicians, we have a team of care coordinators who are the kind of the first level go-to in helping set up the patient, answer any questions they may have. So I think that, you know, I give big kudos to them for being patient. And I think that when it comes to patients, it's usually that they're comfortable to have the session. Sometimes they struggle with the technology and feeling comfortable with the technology. And so we have a dedicated team of our care coordinators who are kind of there as first level support to help the patients feel comfortable. In the event that a patient doesn't feel comfortable, they may not want to use, you know, this type of service. But what the feedback I can say is that we've gotten good feedback, and it's typically the technology that patients aren't comfortable with, and not just having the video encounter. So trying to make our instructions more detail oriented, make sure that our care coordination team is providing coaching and tips to get the patient set up and ready for their encounter has been really, really important for us.
Yeah, and when it comes to our providers, so our whole network is a telehealth network of providers. So when they sign up for the role, they know that that's what they're going to be engaging in. So we make it very clear, you know, on any of our job postings that, you know, this is a strictly telehealth role. You know, we kind of expect you to be comfortable providing a telehealth session. However, we also provide you with the resources, you know, once you get through to training that will help you be successful in that role. You know, all these tips that we've discussed today on how to communicate effectively, establish those relationships. So as long as the provider is comfortable, you know, learning these tips and strategies, that's what we're looking for. And then we can, you know, provide them with that base knowledge that they're going to need to be successful.
Okay, so we had a question come into the Q&A, and I'm going to answer part of it, and then I'm going to send it over to you guys too. So the comment question is, thank you for that very interesting topic presentation. I've been trying to get information on good website manners. Are there any sources, websites that you can recommend? What is the feedback you get from providers regarding performing physical exams? Since telemedicine is new, we really don't have a standard of care in carrying out virtual physical exams. So my part of the answer as the resource center is that on our website, there are 6 videos, I believe, that walk you through different parts of the physical exam, engaging the patient and asking them to help. For example, can you touch your um, lymph nodes, and do they hurt, are they swollen, this and that. So please feel free to check those out on our website. I believe they're in the direct to patient or direct to consumer section on our website. If you can't find them, feel free to email us, we'll get them to you. So again, I'm going to throw this back over to you guys. So what is the feedback that you're getting from providers about performing a physical exam?
Sure, that's a great question. And so at PWN, we focus on a few specialty areas where we provide our consults. And so right now we're not working on, for example, like any acute illness where we would be seeing somebody who would need to see them in person for further diagnostic testing and evaluation. So at the present time, if like Brittany mentioned earlier, that we have somebody who maybe does need a physical exam, we would direct them to follow up with an in-person care provider.
Awesome. Okay, so I have one last question, and then I'm going to let you guys go unless something else came in the Q&A, so I'll hold off on my question. So the question is, the training that you provided is only through your company, or is that through a course? And so basically, I think they're asking, is that publicly available? Is it something that they can look at? And does that include how to document or chart the visit after?
So yeah, this training is completely through our company. It's something that we developed internally because we saw that there was a need. So we just wanted to get it out there as quickly as possible. But all the tips that we've gone through today, we think that they can be helpful in for those of you who want to develop your own trainings. I do think it'd be really cool if we could make this more of a industry-wide type of training. And maybe that, can be a goal of the industry, is to develop something like this and implement it so that we have that standard educational background among all physicians across all companies involved with telehealth. But it's also interesting, one of our physicians, after completing this training, also mentioned it'd be great to have it count towards continuing medical education requirements. So that's something that we started to look into as well, and seeing like how that would be possible to potentially, give our physicians credit for completing these types of courses. So I would definitely say, even though it's just limited to our company right now, it's something that we definitely want to grow and share with everyone else.
Yeah, and I mean, I couldn't agree more. And I think right now, just given, the increase in telehealth utilization we've seen over the past 6 months, like we would love for this to, be some type of standard within the telehealth community. And we would love, if any of you have like any suggestions on also how we can better improve this, maybe there's additional layers of complexity or something like that we can add, like we would love to hear from you.
And CTRC is also working on putting some things together. There is information out there. Maria, since it was your question, there is information out there. It's not called Bedside to Webside, but there is information out there about building rapport and how to work with patients and engage with them over video and things like that. So there's a bunch of miscellaneous resources that I can help point you to, but CTRC is actually looking at developing that once things finally calm down here. So we may very well want to partner with PWNHealth on that. But yeah, so there's that. Okay, I'm not seeing any more questions come into the Q&A, so I'm going to just ask my last question real quick, and if you have any other questions, please answer, or please ask them. There we go. So ladies, I'm curious, you guys talked about educating your providers about the laws, rules, and regulations. Did you have providers, or do you have providers that are working across state lines, and how are you educating them on the differences between this state and that state, and et cetera?
Sure, that's a great question. So one thing that we do as part of our onboarding and training process is that we go into, making sure that the providers are confirming where the person is located at the time of the visit. So one thing that we actually have, so within our telehealth platform that we use, we have default to if it's a phone or a video consult, so they know that, as well as that our platform will only assign the physician a consult in a state that they are licensed in. So that's kind of our safety net to make sure. However, that's why as part of our website manner training, always when they're establishing that connection, we always ask them to confirm that the patient is still present in that state to avoid any issues. And in the event that maybe the patient has traveled and is in another state, if that physician is not licensed there, they'll notify our team, and then we'll make sure to reassign that patient with a provider that is licensed in that state.
Yeah, and typically when that happens, it's pretty rare, but typically what happens in that case is, the patients may put their home address on the consult. So they come in saying that they're from New York, but it turns out they're actually on vacation in Virginia. That's when we'll have to, switch it over to a different provider. But the patients have always been very understanding when that happens too, because, they are the ones that put in the information. So, we thank our physicians for, being so responsive in these cases. And we always stress having good communication between our physician network, our care coordinators, and the rest of our team here, so that we can, quickly and effectively mitigate these problems when they do arise.
Okay, so I had another question come into the Q&A, but I have a follow-up question to that. How are your physicians, or how are you instructing your physicians to verify a patient's identity at the time of the visit?
So during the training, we tell them to ask the patient for their first name, last name, date of birth. And as part of our telehealth platform, we have all that information available to the provider before they even go into the consult, so that once they're on the phone, they can say, okay, can you just confirm your name and date of birth? And as long as it matches what's in the information provided to the provider, then, we're good to go and complete the consult.
Okay, so I'm going to ask this question that's in the Q&A, but I have to give a little bit of disclaimer first, since this is technically a webinar that is hosted by the California Telehealth Resource Center. We are 100% and utterly, completely vendor agnostic. So when you answer this question, please understand that this is absolutely not an endorsement from the California Telehealth Resource Center. All right, the question is, thank you for the discussion. What is your telehealth solution, and is your EMR integrated?
That's a great question, and we unfortunately are not here selling it now because it is a home-built platform that was developed by our internal team. We call it our PWN telehealth platform, but it is integrated with our other systems internally, but it is not, we're not using an external platform.
All right, I'm trying to give people just a couple more minutes because we've had Q&A trickle in. And I don't have any other questions that I can think of, but I'm just gonna, keep talking and see if anybody's gonna chat in. But I do want to thank you guys so very much. It was a very interesting and wonderfully presented talk. And I think that, especially from some of the questions that we've gotten from the audience, it's definitely something that is, maybe needed out there for providers, just a basic baseline. I really do agree with you that, this is something that everybody should be doing. Is making sure that they understand how to be on video and how to interact and engage and all that good stuff. So with that, I am going to go ahead